Hi, this is Charm Kim. I'm a deputy manager of NHIS. Thank you for having me. Today I will explain the National Health Insurance Scheme in the Republic of Korea. Let me get it started. This presentation will proceed as follows. Firstly, I will give an overview of the NHI scheme. Secondly, I will explain the details of the National Health Insurance Scheme. Thirdly, I will inform how healthcare benefits related to COVID-19 will be provided. Fourthly, I will explain the measures taken to expand health insurance coverage. Finally, we'll have time to answer the questions I received in advance. Let me begin with the major characteristics of Korean NHI. Korea has a compulsory national health insurance scheme with universal health coverage. All Koreans should participate in the NHI scheme. The scheme is managed by a single insurer, the National Health Insurance Service. The NHIS has great bargaining power in purchasing healthcare services. Among the whole population in Korea, over 97% of the Korean population is covered by the National Health Insurance. The insured should pay their contributions to the NHIS on a monthly basis. It is mandatory by law for all healthcare facilities to participate in the NHI scheme. Patients are free to choose their healthcare providers, giving them high accessibility to healthcare providers. And now let's take a look at the National Health Insurance Scheme in more detail. There are two types of contribution imposition scheme: the employees insured and the self-employed insured. The employee insured consists of employees and employers at the business establishments where the national health insurance is applied. They are private employees, public officials, private school teachers, and other such people. In their imposition scheme, their health insurance contributions are based on their income. Their monthly contribution is calculated by multiplying the monthly salary and contribution rate. As of 2022, the contribution rate is 6.99%. The rate is shared by employee and employer 50-50. Dependents are those who primarily rely on the employee insured for their livelihood, such as their spouse, lineal ascendants, and lineal descendants without income or properties. The monthly contribution will not be charged to them because the employee insured pays. The self-employed insured consists of all persons other than medical aid beneficiaries, the employee insured, and their dependents. Generally, there are business owners who have no employees, freelancers, temporary workers, and other such people. Contributions for the self-employed insured are computed for each household based on the scores of the household members' combined income, properties, and automobile values. This is because it's difficult to get the income data of the self-employed. The calculated scores are multiplied by value per score for the monthly contribution. The amount per point is 205.3 Korean won. For the self-employed insured who are foreigners and international students, the imposition is the same for everyone, regardless of nationality. The amount of the premium for foreigners and international students, not including F5 or F6, is more than 124,771, which is the average premiums of all subscribers for NHI. If your type of visa is D6 or G1, as shown in the table, your monthly premium will be decided as 98,051, which is a 30% reduction from the average premium. This reduction applies only if the following two requirements are met: the amount of yearly income less than 3.6 million won and an assessed property value of less than 135 million won. For international students with no income, the NHIS charged 60% of the average premium of all subscribed members, which is 56,031. The reduction rate will be scaled to 50% from March 2023. Mandatory subscription of health insurance for foreigners is applied after 6 months of stay from their arrivals. Accordingly, international students have to subscribe to the health insurance as the self-employed insured and pay the relevant premium. For international students on a D2 visa and elementary and junior high school international students on a D43 visa, health insurance will be applied from the date of entry. The students with a D4 general training visa, except a D43 visa, may subscribe to the health insurance from 6 months after entry. International students of Korean nationals residing abroad and overseas Koreans may subscribe to it as of the date of the school admission if they submit their proof of enrollment. The subscription will be automatically processed by the NHIS without the student's application, and the health insurance certificate and subscription notification will be sent to the address of your residence. The following table indicates the co-payment rate of health insurance by the type of healthcare facility. Foreigners and international students receive the same benefit as natives as soon as they enroll in NHI. You may immediately go to the hospital and you will only be charged part of the medical bill without further reimbursement process. As for inpatient services, co-payment rates varies by the disease type. So co-payment is about 5 to 20%. When it comes to outpatient services, patients pay about 30 to 60% of the service expense. Moreover, you may receive various medical benefits such as dental, oriental medicine, medical examination, aid for the handicapped, and medical expenses related to childbirth. These rates are inapplicable to non-covered services such as treatment for diseases that do not affect work or daily life. So how is the healthcare expenditure composed in Korea? The health expenditure consists of two parts. One part is covered by the insurer, the NHIS, and the other is paid by each individual, which is called out-of-pocket payment. Under the NHI scheme, the insurer pays for the covered services. The insured also have to pay their co-payment for the covered services. Moreover, individuals have to pay expense for the services which are not covered by the NHI scheme. Most benefits are provided as benefits in kind at about 96.8%, which should include things such as diagnosis, treatments, surgery, rehabilitation, prescription medicines, and health checkups. However, benefits in cash account for 3.2% of the total benefit, including refunding of co-payment exceeding the cap, appliance expenses for the disabled, and pregnancy examination and childbirth expenses. The scope of benefit coverage is decided considering its clinical effectiveness, cost effectiveness, and financial aspects as well. First, we'll discuss benefits in kind. Benefits in kind are the healthcare benefits that are provided by the healthcare facilities and consist of treatment, nursing, hospitalization for medical examinations, checkups, and surgeries. There are healthcare benefits and health checkups in benefits in kind. Healthcare benefit means that the insured is directly provided with healthcare benefits in the form of tangible and intangible medical services by the healthcare insurance for illness, injury, or childbirth. Health checkups are executed to detect illnesses in advance and provide healthcare benefits according to the insured and dependents. Let me explain the coverage of benefits by dental procedure type. Only people aged 65 or above can receive benefits for complete and partial dentures and implants. Dentures are covered once every 7 years, and implants are covered only twice in one's lifetime. The co-payment rate for the three services is 30%. Benefits for scaling is provided once a year for those aged 19 and above. The co-payment rate is applied according to the rate and amount stipulated under the enforcement decree of the National Health Insurance Act. The NHIS provides health screening service for the purpose of maintaining the health of all citizens through the prevention and early detection of disease. The NHIS provides a free lifetime periodic screening service for the whole population, from infants below 6 to adults over 20 years old. Health screening programs for students are operated by the Ministry of Education. However, other than the screenings for students, all are managed by the NHIS. For office workers, general health checkups are available biannually, free of charge depending on their year of birth. And for non-office workers, it's annually. Now, let me tell you how benefits in kind are provided. Benefits in cash are provided. Let's say the insured faces an emergency or inevitable situation and has to receive medical treatment or go through childbirth in an institution other than a healthcare facility. In this case, benefits are provided in cash to cover such expenses. Healthcare costs, auxiliary equipment for persons with disabilities, the co-payment selling system, and medical treatment fees for pregnancy and childbirth are covered. Let's move on to the next slide to go into the details. First, healthcare costs are partially covered for purchasing respirators, diabetes management devices, airway pressure equipment, and other instruments. So the insured only pays 10 to 50% for covered items. The co-payment selling system aims at reducing excessive medical costs borne by the people by setting the copayment ceiling amount according to the income level of the insured. All costs exceeding the upper limit are covered by the NHIS. Finally, medical treatment fees are supported for pregnancy and childbirth in the form of a voucher that can be used to copay covered and non-covered services and items. Special estimate cases are granted to patients with severe illnesses to prevent poverty arising from excessively high costs of medical treatment. Diseases covered by insurance include cancer, cardiac, rare illnesses, and severe incurable diseases. Special estimate costs are granted so that the insured only pays 5% of outpatient treatment costs for severe illnesses like cancer and 10% for rare and severe incurable diseases. Medical treatment costs for tuberculosis are completely covered without copayment. Let me introduce the medical treatment benefits provided for inpatient and quarantine treatment due to COVID-19. Applicable targets are those confirmed with COVID-19 and who receive a notice for inpatient and quarantine treatment by being reported in accordance with the guidelines on response to COVID-19. If the person receives a professional rapid antigen test, RAT, at a medical facility, the doctor's consultation fee incurred during treatment is covered by copayments. However, copayments for pills and prescribed medicine to treat COVID-19 are supported after the recipient is confirmed with COVID-19 by the professional RAT. Also, expenses for inpatient treatment, domiciliary care, and medical examination are supported during the medical treatment period. Foreigners, including unqualified foreigners, receive the same benefits as local residents. For confirmed cases abroad, the principle of reciprocity among states is applied. The period of medical treatment support starts from the initiation date to the completion date of inpatient and quarantine treatment or treatment at home after receiving the notice of inpatient or quarantine treatment. Copayment is supported until the date of release, generally 8 days after the initiation date. In inpatient treatment, domiciliary care, medical examination, and other medical care regarding COVID-19 are supported. Benefits are only covered by the medical treatment period. So any prescribed items after the completion date are not supported, even if they are the pills or prescribed medicine for discharge. Next, let me tell you what measures NHIS takes to expand coverage. We are seeing process in 5 major categories. We are almost done with expanding benefits for 3 major non-covered services, such as treatment in the higher patient room, and we'll proceed with including medical necessary services in the benefits package that are not currently covered within this year. We have completed the assignment of reducing copayment for vulnerable groups, including elderly, children, and persons with disabilities, and have significantly improved the copayment ceiling system. Let's look at some assignments in detail. We have also improved the co-payment selling system to reinforce the medical safety net to reduce the burden of excessively high medical expenses imposed on low-income households. As a result, the annual co-payment selling amount for the bottom 50% income group was reduced to 10% of annual income. Foreigners and international students residing in the area marked on the map can visit the relevant NHIS service center for foreigners. And international students residing in other areas can visit the closest branch to take care of tasks involving the NHIS. Should you have any questions with regard to the health insurance scheme, please try calling 1577-1000 for the NHIS Customer Service Center. And in the case you wish for a consultation in English, Chinese, Vietnamese, or Uzbek, please try calling 1-33033-811-2000 or 1 for specific and kind guides. At this time, we'll have time to answer the questions I received in advance. Number one, my public insurance cost goes monthly from my university payment. I am 50 years old and have 4 family members, wife and 3 children. How do you calculate the cost? The insurance contribution rate for the employee insured is 6.99%, which shall be borne 50-50 by the employer and the insured. Family members of the employee insured may be registered as dependents, and the premium amount does not change by the number of dependents. Number 2, my son got a car accident in a school zone. On the way to home, his left leg bones were damaged and needs to have an operation. How much does the NHIS cover the costs of the operation and the rest of the hospital stay for treatment? According to Article 53, Restriction of Benefits of the National Health Insurance Act, traffic accidents are not subject to health insurance coverage if they are involved with criminal acts that have been intentionally set up or have occurred by gross negligence. Moreover, car accidents shall be dealt with through insurance following the compulsory motor vehicle liability security act. However, if the NHIS has provided insurance benefits in advance, it shall possess the right to claim damages to third parties within the amount of the covered benefits. The scope of health insurance coverage cannot be confirmed by the amount of surgery or inpatient care expenses. The current medical fees schedule covers premiums according to the fee-for-service system. So the amount varies by service, such as the medical material, inpatient and outpatient care, medicine, and type of medical care facility. Number 3, one of our children has 2 wisdom teeth. We wish to go to dentist to pull off them. Does the NHIS cover the cost partly? What about regular scaling costs for adult and children? What condition you have? Wisdom teeth extractions may be covered by health insurance, but the co-payment rate varies by the type of medical care facility and treatment. Any health insurance subscribers aged 19 and older and their dependents may receive benefits annually for scaling. Number 4, if my wife and one of my daughters were unfortunately infected by the COVID-19 and had to be admitted to a designated hospital in Korea. Both of them were in a serious situation as they were hospitalized for over 3 weeks. Does this COVID-19 case be supported by the National Health Insurance? If it is, what percentage we need to pay to hospital after the National Health Insurance? As of April 2022, inpatient and quarantine treatment fees are fully covered. This means all expenses, including treatments, examinations, and checkups for hospital care for COVID-19 are supported. Beneficiaries are patients confirmed with COVID-19 who are issued with the notice for inpatient and quarantine treatment from the health center or hospital, and those suspected of being infected under the guidelines on its response to COVID-19. The period in which beneficiaries are supported is from the initiation date to the date of release of inpatient care, quarantine treatment, and treatment from home. Besides, various services are supported, including but not limited to sound pressure quarantine treatment, sick beds exclusively for patients with advanced diseases, and hospitalization fees for intensive care rooms. However, some subjects are excluded from receiving benefits. Suppose an international subscriber comes from a country where the principle of reciprocity is applied, or there are reasons attributable to the international resident. In this case, benefits are not provided for co-payments and essential non-covered services arising from inpatient and quarantine treatment for COVID-19. The Ministry of Foreign Affairs priorly notifies whether the international subscriber's home country is subject to the principle of reciprocity. Then this information is posted on the COVID-19 menu of the Korea Disease Control and Prevention Agency website on the last week of every month, which takes effect from the beginning of next month. Number 5, I am 57 years old, working in Korea for 8 years. The recent medical checkup brought a shocking result that cancer has been spread in my lung and bloodline. Does the NHIS have the treatment of the cancer? If then, how long and how much do they help? Health insurance subscribers or their dependents diagnosed with cancer are subject to receiving special estimate cases for severe illnesses. Therefore, the copayment rate is 5% for inpatient treatment, and the application period is 5 years from the diagnosed or confirmed date. If continuous anti-cancer treatment is required, the application period may be extended. Number 6, does the NHIS cover the whole scope of the medical treatments for the registered members? If not, what kind of health sector does not get supported, as it is the private insurance scope? And is the national insurance service limited to foreign members for certain conditions compared to local Koreans? Is the foreigners month fee the same with Korean people? Health insurance subscribers and their dependents will bear co-payment for a portion of expenses if subject to receiving healthcare benefits. However, non-benefit services and items are inapplicable in this case. This matter applies to international subscribers as well, so there are no limitations or differences in how the benefits are provided. Monthly premiums are generally charged by the average insurance fees of self-employed insured. If the international subscribers' income and property are accessible like nationals, the same calculated criteria are applied for premium charge. However, the minimum threshold is the average premium of a self-employed insured. There is a system that supports catastrophic medical expenditure by type of disease, household income level, and type of treatment for non-benefit services. Foreign and Korean nationals abroad are not supported with catastrophic medical expenditure apart from some exceptional cases, so we did not include this matter in this webinar. Number 7, I have been in Korea for 3 years. Recently, my wife and one child joined me from Europe. If I add my family members for the national insurance through my university, how much would the cost increase? The premium of the employee insured varies by monthly salary, so family members as dependents does not change the insurance cost. Number 8, when you go to pharmacy for 3 months prescribed medicine of high blood pressure and sugar, how much percentage does the national insurance generally cover? The copayment rate is 30% when purchasing official medicine. However, if you are 65 or above, the rates may change depending on the prescribed illness and whether your prescription has been made at a tertiary hospital or a general hospital. Suppose a patient with high pressure or diabetes received outpatient treatment at a clinic and expressed his or her intention to continuously receive outpatient treatment. In this case, please note that the copayment rate for outpatient treatment is 20% of the examination fee and 30% of the amount excluding examination fee from healthcare benefits. This is all I have prepared for the presentation. And if you have any other questions, please ask during the question time. Thank you for your attention. I hope this presentation may help you to understand Korean NHI scheme. Thank you.
Thank you very much.
Yes, thank you, Chami Kim. I certainly learned some things. I've been in Korea almost 20 years and have been on the health insurance that entire time, and yet I learned things today. So again, I'm grateful for your explanation. We are now also going to be joined by Mr. Hyunjin Cho, who is a Deputy Director from the Department of Global Cooperation at the NHIS. He has been working at the NHIS since 2003 and thus has abundant experience in the field of international development cooperation in global health. And while working at the Department of Global Cooperation for 7 years, he has worked with a number of partner countries, including those from ASEAN member states, as well as Ethiopia, Ghana, Indonesia, Oman, and others. And currently, he serves as the coordinator for WHO Collaborating Center, that is the World Health Organization, and is working with WHO for a case study on digital technology of the Republic of Korea. He, along with team members, is now planning the 19th International Training Course on Healthcare Systems and the second executive leadership development course on social health insurance, both of which will be taking place in August this year. And so Mr. Cho and Ms. Kim will now be answering questions. And there are, excuse me, two ways to pose your questions. You may, at the bottom of your screen, you should have an icon called reactions. And if you click on that, there you can raise your digital hand and I will then call upon you. Or you can pose a question in the chat and a NAFSIK board member, Elena Kalinic, will be monitoring that and will assist me in making sure that I am aware of all the chats. So I welcome questions, and it looks like we already have a few chats, so I will start with those. So the first is, there is a 1 month gap between the date of my retirement and the final date of my E2 visa. If I were to need healthcare during that month, how would the cost be calculated? And can I pay for premium myself to prolong my insurance enrollment, or do I pay for everything out of pocket? That is our first question.
Hi, hello. My name is Hyunjin. I thought this presentation will be more about the policy in general about the National Health Insurance Scheme. And since it seems like the question you just asked is very technical, so I think it's better for us to get back to you in writing so that we could give you a more precise answer to your question. So please, if you allow us, then can we just collect those like very technical questions, and then we will do our research and to come up with a more precise answer to your question.
Yes, thank you, Mr. Cho. I think if you can ask generally more broad questions about the healthcare scheme in general that may be applicable to all, that would be helpful. And as noted, if there's very specific questions, then those perhaps can be addressed on a one-to-one basis. The next question as well is a little more personal and may be the same. But the question is, my husband has muscular dystrophy, which is an incurable disease. Will his co-pay be 10%? And so that again may be too detailed, but if not, then let's try to answer that.
Yeah, like again, the co-payment varies. I mean, or you can call it co-insurance also. If you are hospitalized, if you are diagnosed with a like a rare disease or incurable disease, it depending on the severity of your condition. So it can drop to 10%, but please, you need to remember, please, you need to note that there are some services that are covered that are not covered National Health Insurance benefit, which means you have to pay for those non-covered services 100% out of your own pocket. So again, this is a very specific disease. We do not have, I cannot remember the list of the diseases that are categorized into like rare or incurable diseases. So again, we will need to get back to you for that question as well. Thank you.
Right. I think the next question is applicable to many, whether you have a Korean spouse or not, and that is about retirement. The question reads, I am a foreigner, but I live in Korea. My spouse is Korean. If I retire in Korea, how will my health insurance be covered? Will I be covered by the NHIS, or how will that be handled? And I think I had a similar question, is how is the insurance handled after retirement?
Yeah, we don't discriminate foreigners or expatriates living in Korea against Korean nationals. So if you retire and if you do not have any income, whereas your wife is still employed, then you will be acknowledged as one of your wife's dependents. So, but you'll be of course provided with the benefits. by the National Health Insurance. But again, please note that if you have an additional income, then NHIS will charge you for monthly premiums as well, based on your income.
Okay, but a clarification there, that if you have worked here and paid into the system and then retire and remain in Korea, you are still covered after your retirement. Is that correct?
Yeah, even if you do, you have no history of paying into the system. If you are legal in Korea, and then you'll be you are entitled to the benefits package provided by NHIS. In case of America, if I remember correctly, they have to pay into the system while they're working, right? And after they retire, then they'll be able to receive some benefits from as like Medicare beneficiaries, but it's not the case in Korea. It's not mandatory for you to pay into the system. As long as you stay in Korea legally, and then if you do not have any income, and if you are married to someone who has a job here in Korea and who is acknowledged as a employee-based insured person, then the person will be acknowledged as a dependent. So the person will be entitled to the same level of benefit because the person is a dependent, and the NHIS will cover.
All right, very good, thank you. Joanne, I believe you have a question for us. Thank you for raising your hand. You seem to still be muted.
Hi, I have been to the office in the tower a couple of times to try and get my questions answered. And when I've been there, there hasn't been anyone there that speaks English. And I am wondering, I do have a couple of questions. One of them was about muscular dystrophy, and you say that that's not broad enough to be answered here. So where is the best place for me to get more information?
Sorry, can you ask your question again? Because I missed a part.
Yeah, I've been to the Foreigner's Assistant office in the tower twice, and neither time there was anyone there that could speak English and help me. And I did submit a question about my husband's muscular dystrophy. And so what I'm wanting to know is, where is the best place for me to get more information?
All right, like general information about the benefits. May I ask may I ask where you live in Korea?
Uijeongbu.
Uijeongbu. Okay. We'll pull up a list of foreigner support centers across the nation. Then we'll get back to you with the name and the phone number of the person who's in charge of your jurisdiction. And then
Okay, great.
And we'll make sure that somebody who can speak English will contact you.
Thank you very much.
Actually, we do have an office in your area. So Uijeongbu Center. So again, we'll get back to you with the phone number and the person who can answer your question. So you are wondering about the benefits, right?
Mm-hmm. Yeah.
Okay. We'll just leave a message. There's someone who is curious to know about how to receive benefits in the area of Uijeongbu City. So we'll get back to you again. Thank you.
Okay. All right. Thank you.
I think that's an important question, though, that maybe many people have that are not able to attend this meeting right now, or maybe watching it online later, that because you're very kindly saying we can send you this information, but how do we as foreigners find that information in general? Again, if we're not attending this meeting or do not have this wonderful personal access to you at the moment, where do we search for this?
Please Google National Health Insurance Service and then open up the homepage of NHIS, there is an English version. It's not equivalent to what we have in Korean, but still you'll be able to get some general information about the national health insurance and the benefits we provide through our homepage. So nhis.or.kr, or just Google it, and National Health Insurance Service of Korea.
And that does that include the information of these local offices that we can contact?
Yeah, to my understanding, yes, that's correct. And it may not be as specific as what we provide in Korean, but there are some, I mean, you'll have access to some general information about the National Health Insurance Scheme, and you can find some phone numbers over there as well.
Very good, thank you. Richard, I turn the time to you.
Oh, okay. Now I have a quick follow-up question to this question that I asked earlier, that I'm a foreigner and if my spouse is Korean, if I retire in Korea and so forth. Okay, so, and the answer that you gave, I understood that you said that foreigners and Koreans are treated equally. And you said, if I have a spouse who's working, then I would be covered through, if I have a spouse who's Korean, who's still working in Korea, then I would be covered like as her dependent. Or, okay, but what if both of us are retired and neither of us is working? Then how does the coverage work?
All right, good question. We have two different types of insured persons. One, that's based on employment. And the other one is, we call it like self-employed persons, or
Okay.
you may call it informal sector, who is not technically employed by any workplace in Korea. So then we charge premiums based on household unit. So like, just assume that there are 4 members, like you and your wife and 2 children, or let's say there are students without any income. And then in order to come up with, in order to calculate how much money you pay into the system every month, we consider your income. Even though you are not employed, there must be some way for you to earn some money, right? So we consider your income and properties, also cars. So those three factors we consider to come up with your monthly premiums. For example, if you have an apartment here in Korea and there is a price tag to it, right? And also we have access to your car ownership that's renewed on a monthly basis, and we have also access to your property ownership that's renewed on a yearly basis. So we have all the information sharing, and then we have access to very vast amount of information about your income, your properties of apartments or real estate, or your cars. So we have it's kind of complicated. We have a table attached to each section: income, property, and cars. And then we come up with the scores. And the scores, each score is given a amount of Korean won. So it varies every year. I mean, there is a slight increase every year. I mean, I'm talking about the amount that's assigned to per score. So we add up all the scores based on your income, property, and cars, and then they say the score of your household is like 300, and then there's a amount assigned to score, and then we calculate, multiply the amount with the scores. And please note that in this case, we will include every single household members. So we charge on like household basis, not individually.
So if you're retired, and I mean, there's an assumption that you will be working, or well, but eventually, people can't work. But then, based on the remaining things, such as the value of our home or our cars or whatever, we still are expected to pay, a monthly amount. Even if we're out, even if we're retired. I think that's what you're saying, basically.
Yes, but it's kind of complicated to explain to you globally, but just okay. Well, okay.
I
Okay,
think it's
let's say,
okay.
like,
I don't want to dominate the time too much, so let's
right,
move on. We've got
okay, let's
limited
say,
time.
yeah, let's say that if you're employed, right, and you get like a monthly paycheck, and then you'll be acknowledged as a employment-based insured person, and then you will be able to have your dependents. But in case of those who are not employed and they cannot have dependent, that is one of our challenges to that we need to deal with, because sometimes people are complaining about the equity problems, right? My case, my wife, she doesn't work, and my children, they do not work. My parents, they retired and they do not have enough income to support themselves. So I have 5 dependents on me. But who's gonna pay? I'm the only one who pays into the system. But please remember that if you are super rich, and your property is beyond like $1 million, then you won't be able to be acknowledged as a dependent. So I'm just talking about the general cases.
Okay, I have one more follow-up question with that. I guess I'm nearing retirement age, unfortunately. But so if I have no income except just my pension and no property and no car, am I still charged a monthly premium based on my pension?
That's correct. The pension, unlike just regular income, your pension will be only half of your pension will be acknowledged as your income if you're retired. So the amount you pay will be different. If you let's say you earn like $1,000 as your pension, then we consider that your income is 500. So only half. In case of a pension, it's only half. So like $500, there's a table for income, right? Then we check the scores, how many scores will be given to those who earn $500 per month. And we also include your, again, property, apartment, even though you do not own your apartment, 전세 here in Korea, 전세, like deposit. Even though you do not own your own apartment or house, we have our own way to come up with how many scores will be given to those. Let's say like you live in a certain apartment unit and you own it and you rent it, will be different. So if you own, the scores will be higher, right? If you rent the same unit, then the scores will be lower. So like, also there's another score from your property table. And also if you buy a car and if you sell a car, then we have a monthly basis like information access. So then your monthly premium will be automatically adjusted based on the ownership of your property and cars. But when it comes to property, the information comes to us on a yearly basis. When it comes to a car, on a monthly basis. So like sometimes people are complaining that why I have to pay a lot of money for national health insurance, and I do not have even a house or apartment. So like we ask, when did you sell it? Yeah, I sold it like last year, like October last year. Then bring us the proof that you sold your apartment, and then we adjust it. Or if they wait long enough, then we'll have the information about anyone selling their house. Then we'll automatically deduct the premiums and reflect it in upcoming bills. So it's automatic, but if you are not patient and Well, when it comes to like property or like such as like a house or apartment, it takes up to 1 year to be reflected in your monthly premium. So you better give us a call.
All right, that's actually very helpful information. Thank you. I hope it helps others as well. Do we have other questions? Again, we can put them in the chat or you can raise your digital hand.
I welcome the questions that are regard to some like the general policies, I mean, the directions of the national health insurance schemes should be also specific questions.
Very good. Let's turn the time back over to Joanne, please.
Hi, I think this is general enough. I believe I read that the insurance will cover some in-home care for disabled. And I'm wondering how we go about applying for that, or who do we contact to get more information about it?
Thank you again. This is one of major tasks that NHI has performed for the entire population. We have a long-term care service, long-term care insurance. I believe you are asking about that service.
Right.
May I ask how old the person who needs
75.
services? So that's correct. Okay, we have a national health insurance, right? National health insurance service where we are working for is a single insurer of national health insurance. Also long-term care insurance. I believe, is there anyone from Germany or some other countries? Like in Korea, Korea is one of very few countries that have national health insurance and long-term care insurance as well. So to be more specific about the amount you pay into the system, Ms. Kim introduced that 6.99% of a monthly paycheck will be paid into the national health insurance scheme, right? To be more specific, there is additional charge, 12.2% of your national health insurance will be paid as long-term care insurance. Can you understand it? It's kind of complicated. Okay.
I think I do.
Okay, national health insurance, long-term care insurance, and National Health Insurance Service of Korea is an insurer of both schemes. So we only send out bills that says national health insurance, but if you take a look very close at it, you'll say there's a long-term care insurance that's attached to national health insurance. So without you knowing it, you are paying into the national health insurance fund, long-term care insurance fund as well. So that is 12.2% of your national health insurance monthly premium. So in that case, you apply for the long-term care services in a nearby branch offices. You know, there are 178 branch offices and also like more than 200 long-term care centers. If you find a national health insurance branch office anywhere in Korea, that means there is a long-term care center attached to the branch office. So, and then you apply for long-term care services, and then national health insurance staff members will pay you a visit to evaluate the severity of your conditions, whether or not you'll be able to conduct your daily life without any help from others. Then you will not be eligible for the services. But if you absolutely need some help from others, you need to depend on others for living your daily life, then we evaluate the severity of your conditions. There are 5 grades, 1 through 5. Depending on the grade you will be assigned or given by the staff members of NHI, as you'll be able to receive different types of services.
Okay, great. And you said that you will be getting to me the Uijeongbu Center contact information?
I will make sure that you have questions about the benefits of national health insurance. Also, services of long-term care, and then yeah, we'll get back to you with the phone number
Okay.
and the number
Great.
comparison. Mhm.
Okay, thank you.
No
We'll
problem.
try to provide some of that information on the NAFSIK website as well, so that we're communicating with everyone. Let's see, do we have any other questions?
I think we have a question in the chat box.
Oh, yes, sorry. Okay, you were right. Are dependents applicable to direct members? I am single, so technically my parents are my direct dependents who may avail of support. Will there be a chance to extend it to siblings?
That is very technical question. There are so many variations. Just give me 1 second. Let me discuss with my coworkers here. 1 second, please. 저기 뭐 싱글이
After this, we might have a last one more question. While the speaker's coming back, whatever the more detail, after this, if you approach me, send an email to me about your request, I will communicate with the health insurance services and then come back to you with the answers.
I discussed, but we'll also like find more specific cases, but now I can give you an answer. Is like you can have your siblings as dependents as long as they are under 30 years old, as long as they do not have incomes. That goes to your parents as well. But again, we'll check, because this is the case of expatriates living in Korea. As far as I know, there is no discrimination, but that is very technical, and I'm not quite sure if there is any like exceptions to it. So let us get back to work and research, do some research, and get back to you with more specific, more precise answer. But now I can say that if there's no discrimination, which I believe is the case, then you'll be able to have your siblings as dependents as long as they are not over 30 years old. Oh, they must be single. They can, I mean, married siblings won't be able to be dependents.
All right, very good. So we'll open it up to one last question. If no one has a question, I do, but I can hold off on mine. Elena, please.
Thank you very much for questions. Just to follow up on the previous question, what about parents? So we talked about siblings. What about parents? Are there any requirements for the parents in terms of income and age?
Yeah, like I explained earlier, that your parents, as long as do not have their own incomes, then they will be able to acknowledged as dependents on you. Yeah. So like again, we'll be more thoroughly researching or and then get back to you with more precise answer, because like there are so many cases that came. I mean, they are like considered abnormal and unacceptable. So the answer that I just gave you replies like is only general cases. So we'll try to find some anyway, we'll get back to you. We'll take your questions and then do some more research and then get back to you with more precise answer.
So the last question that I have is on a completely different subject, but my understanding is that whether you're Korean or foreigner, that if you are traveling abroad, that you are not covered by Korean health insurance at all. Is that correct?
That's correct.
All right, that I just wanted to clarify that. All right, with that then, thank you once again to everyone who has participated today, and particularly Mr. Cho and Ms. Kim for their answers to our very detailed technical questions and for the excellent presentation in general. And now to wrap things up, I will turn the time to David Kim, please.
Thank you, Heather. Thanks for everything. Once again, I just know that this is a very busy time during the first semester, and with the condition of the COVID-19, your teaching will be very hard. Once again, I thank you for everybody, our NAFSIK member, as well as visitors for joining this National Health Insurance Seminar. Again, I want to thank you for our main speaker, Chami Kim, as well as Hyunjin Cho, Deputy Director from the National Health Insurance. Wonderful. We had a great time to learn about the systems in Korea. I believe that it will be a great information for our members as well as family. I also thank you for the Heather chairing this seminar, and Doruk organizing this Zoom system, and Elena cooperating with chat staff. After this, as we just discussed it, any questions you haven't got the answer, please send the email to me about the list. Then I will communicate with Chami Kim, and the Chami Kim will come back with the individual answers. And then also our Zoom is being recorded. It will be uploaded in our official NAFSIK website. So if those your colleagues who wasn't able to come today, please let them know they can actually watch this Zoom lecture, so they can get also more information about the health insurance. Once again, today is a wonderful time. As a condition of the pandemic is getting better, our NAFSIK, we're thinking about after this discussion with our committee member, we will thinking about in October, might have an outdoor picnic if that condition is good. First week and second week, it's a long weekend, so we're thinking about in considering having an outdoor picnic for our NAFSIK member. Then if we decided, committee member decided, I will let you know. So please, meantime, just be safe. Once again, if you are a visitor of this Zoom, please join with our NAFSIK as a member. That would be wonderful. We are, as Doruk mentioned, we are looking for your scholarship, your research conducting in Korea very well to promote the Korean studies, as well as Korean research become a more globalization, which Korean government still happy to do so. So we are so thankful you guys conducting research in Korea. So once again, thanks for everybody to joining. Next time, we'd love to come back with you with the other more practical and then good welfare systems. Thanks again. See you next time. Bye-bye, guys.
Thank you.
Thank you very much.
Thank you.
Thank you.